So once again, this is APH's Access Academy, and today we start a 3-part webinar series called Meaningful Living. Specific to our time here together now is we get to explore the topics nutrition and disease prevention. We're having a little bit of technical difficulty today with our slide deck, so bear with me as I share with you a little bit about our inspiration today for talking about health education without having a slide to go with it. It's about an APH product. As I had mentioned, it's called Health Education for Students with Visual Impairments, and it is a guidebook to teachers. And this is actually a product that launched almost 2 years ago. And I don't know, based upon our poll results today, maybe it might be one of those best kept secrets at APH, which is not necessarily what we want. We want you to know about it. So this particular guidebook, it draws in the expertise of 5 seasoned professors and teachers, and it covers diet, nutrition, personal health, sex education, disease prevention, and injury prevention and safety. So there's a lot of things in this book, a lot of tools that are going to help teachers be able to make sure that health education is accessible for our students with visual impairments. Perhaps one of the most important things to mention about this guidebook is just so that you know, it is not a curriculum, but it is a guidebook that is full of activities. It is $75 and it's federal quota eligible. Inside, I had a slide that was prepared just so that you knew about product details. Inside this particular book, when you dive into the contents, there are sections or chapters that give you an introduction, like an overview of what we need to know about this product. Again, emphasizing that it's not a curriculum. We have diet and nutrition, as well as diseases that we're highlighting today because this is our topics for today. But also in this curriculum, again, there's that personal health, the sex education, injury prevention and safety, and an index. What you can expect from our webinar series today is that we are here today for diet, nutrition, and diseases. We come back in a month in November and we talk about personal health and safety. And we close things out in December with a webinar on sex education and how we can help our students with accessing health education. So we hope that you will be back for us. I want to introduce to you our presenters for today. And delivering the learning today is certified teacher of the visually impaired and orientation and mobility specialist. She is incredibly busy because she's also a doctorate student, a candidate, pardon me, at Florida State University, and she is Erika Fundelius. She has many passions within the field of visual impairment, and her dissertation broadly surrounds the self-determination section of the expanded core curriculum. I love it when she is able to come to us and speak at APH and infuse that ECC into what we're talking about. Also, joining her is Manda, Nordes, a person who wears many, many hats. She is also a credentialed teacher of students with visual impairments, working as a TVI, and mentors teachers who provide itinerant county-based services in the Central Valley of California. I want to share with you that over the next 90 minutes together, we will, here are our objectives: examine the health standards, discover activities to use for direct instruction or accommodation for instruction in the area of diseases. And also, we want to correlate the importance of everyday activities between diet and nutrition and disease prevention. So, Erika, thank you for being with us today. And Manda, we are excited to get to learn from you both today.
Good morning, everyone. We definitely have, I need to learn how to drive PowerPoints in the background. So I apologize. I don't know why it's not working today, but we'll get to that. So today we will center our discussion on health standards that we should be working with. We'll touch on some common diseases. And then we also will discover how diet and nutrition could be preventative as well as healing, and discuss how we can, and this is where you will come in into the discussion, how we will center our instruction in the expanded core curriculum. But before we begin, we would like to share with you a 4-minute video that does have closed captioning. So let's dive into that together. And let me make sure. Can you hear it? Can you hear the video? Okay, good.
A lot of people think that health is shaped solely by healthcare. But what we're finding is that social factors like education have a larger impact on health.
Research shows that only about 10% of our health outcomes are determined by healthcare. Our Education and Health Initiative is trying to raise awareness about the importance of education to health and the way that they are connected.
Education impacts health with different layers, right? There's education about personal behavioral choices, and that people who are who have more education tend to make healthier choices. But then there's the sort of the social determinant piece of this, which is when you have an education and when you have access to a career and to income, it sets you on a path where everything about the decisions you make day in, day out are the healthier choices.
Education in my community goes a long way. Being educated now means getting better employment, teaching our kids to be successful, and just making a difference in just in everyday life.
And those who have higher levels of education have greater exposure to both people, resources, and information that have a focus on healthy lifestyles, which include not only eating habits, but also level of physical activity and awareness.
Being able to advocate and ask for what you want helps to facilitate for a healthier lifestyle. So if it's needing your community to have green spaces, have a park, a playground, it's important to know that you can advocate for yourself and for others.
Self-determination can open a lot of doors for a lot of people. It's best to pay it forward and become a mentor to someone else and help them out and show them that being a self-motivator, anything is possible, anything is achievable. Our kids need to see us all become self-motivators.
In any neighborhood, committed parents and a nurturing home environment are very important to a child's education. But neighborhood conditions do matter.
Well, I've lived here for about 8 or 9 years now, and it is hard for kids to think about the future because there's so much crime and violence going on in the neighborhood.
Things just like not eating or having someone to make you feel safe, it would kind of be impossible for you to get to school and feel a sense of security or safety, to even be able to let your guards down, to be able to learn.
If you have a neighborhood that's not motivating and stimulating, then your motivation itself will lack. So if the best thing that you see in your neighborhood is a drug dealer, then that becomes your goal. If the best thing you see in your neighborhood is working a 9 to 5, then that becomes your goal. But if you see the doctors and the lawyers, if you see the teachers and the professors, then that becomes your goal. Poor neighborhoods oftentimes have poor schools, and these poor schools oftentimes lead to poor educational outcomes. And these poor educational outcomes oftentimes lead to poor jobs. And these poor jobs push you right back in these poor neighborhoods.
Part of what we're trying to do with this initiative is to connect the dots, is to help people in the healthcare field understand the importance of education as a potential strategy for preventing disease and lowering healthcare costs, and helping the many people who are working in the area of education reform to recognize that improved health outcomes for our children and later adults are among the benefits that come from a better education. If we really want to save lives in this country and prevent disease and reduce healthcare costs, we have to do something about education.
Okay. And with most of what we teach, it is important to align the standards, especially in this area of focus, if this is an area of focus for a goal. Every Student Succeeds Act identifies school health and physical education as part of a student's well-rounded education, which our students have free and appropriate access to under FAPE. Over the years, many measures have been taken in order to promote engagement in coordinated school health programs that focus on a holistic perspective. The Center for Disease Control and Prevention has released a model for learning called Whole School, Whole Community, Whole Child, which focuses on the relationship between learning and health, which was really mentioned in the video that we just watched. The holistic approach emphasizes the following 10 components: health education, physical education and physical activity, nutrition, health services, counseling, psychological and social services, access to a positive social and emotional climate, physical environment, employee wellness, the importance of family engagement, as well as involvement within the community. And at the school level, we see that health instruction is shaped by health education curriculum. The National Health Education Standards were designed in 1995 and revised in 2007, and they serve as a framework for designing and selecting curricula. In 2011, the National Sexuality Education Standards were updated, and both the National Health Education Standards and National Sexuality Education Standards have become an accepted reference on health education and a guidepost for the adoption of standards and curriculum in most states. Today, we're going to be focusing on the National Health Education Standards to really uncover what they are. And these standards were developed to establish, promote, and support healthy behaviors in students at all grade levels. Not only does it promote these healthy behaviors, but it also provides parents an understanding of what the expectations for health education should be in the schools. The Society of Health and Physical Educators, also known as SHAPE, consists of over 200,000 health and physical education professionals across the United States. So SHAPE America was formed and has worked to develop the standards that we are discussing today. And there are 8 main standards in which students learn about the concepts related to health promotion and disease prevention, and also how family and broader culture can influence health-related behaviors. There's also standards involving skills to access materials and services, better their social skills, self-determination skills, and to practice healthy behaviors and avoid and reduce health risks. The 8 standards have developmentally appropriate skill sets defined on a national website, which is included in your references handout. And so if we look more in depth at the standard that is set apart by the Center for Disease Control and Prevention, it provides performance indicators that state what a student should know or be able to do in support of the National Health Education Standard. And it targets specific grade spans. So we're going to look at the first health standard, which says students will comprehend concepts related to health promotion and disease prevention to enhance health. And the first block is pre-K to grade 2. And really what we would expect by the end of grade 2 is that a student would be able to just identify healthy behaviors that could positively impact their health. This might be understanding that going for a walk is something that has a positive impact on behavior, or maybe it's taking a vitamin or eating a fruit and vegetable. Really, that's what we're looking at and trying to emphasize prior to grade 2. By the end of 5th grade, students would be expected to describe the relationship between the healthy behavior that they already learned and their personal health. So this is an idea that when I sleep well or eat well, then I feel better. We're just making that initial correlation between what we do and how it affects personal health. By the end of 8th grade, the guidelines want students to dive deeper in their ability to analyze the relationship between healthy behaviors and personal health. So this expands on the when I sleep well idea that we had in 5th grade. And it takes it to when I sleep well, I wake up the next day and I have more energy and better focus. And finally, by the end of grade 12, the expectation that students will be able to predict how healthy behaviors can affect health status is what's emphasized. So this is a concept like, if I incorporate exercise into my life when I'm young, then I'm going to be improving my cardiovascular fitness and my physical fitness, and I'm likely to live a healthier life. Or if I remove movement and exercise from my life, I may have an increased risk for something like heart disease. So that's really how the standard breaks down and the different focuses that we have for the grade levels. But in order to ensure our students have full participation in health education instruction, we need to know where to find what is being taught, because each state varies slightly, but 46 states either encourage or require health education for all grade levels. And Shape America has pooled a wealth of resources for each state in their state standards and advocacy resources. These resources include key state contacts, stakeholder group information, as well as information regarding Every Student Succeeding Act and the state's health and PE standards. And again, circling back to the Every Student Succeeding Act, that identifies that school health and physical education is a part of a student's well-rounded education. Another resource that provides data to help track, another resource is the CDC School Profiles, and it provides data and tracks the progress of the implementation of school policies and practices around improving student health or the health of students in the schools. It really monitors the current status of school health and education requirements, physical education and physical activity. This might be practices related to bullying and harassment, which again focuses on the social and emotional health of the student. Policies related to the prevention of tobacco use and overall nutrition. School-based health services. Is the family involved? Is there comprehensive community involvement? And it also states what the school health coordination is for each state. And this information allows schools and districts to really track the implementation of wellness policies and practices and identify areas of needed professional development or maybe further planning for health-related programs. Both of these tools that we mentioned, the CDC School Profile, as well as the state standards and advocacy resources shared by Shape America, will allow you to become a more informed educator for your state and for your area. Now in this webinar, we will focus on disease and how nutrition plays into health and well-being.
All right, it is my turn regarding diseases. I know that the beginning was a little bit like, what are we talking about, especially for those of you who are providing services for adults, but I promise that we are going to circle back and even have information for our SLP who hopefully is still in the audience. But the question is really, why should we educate our students on diseases? And it's pretty blank because infectious disease knowledge and behaviors are key to our students' health and safety. And this is why we started with the standards, because you will have to align and assist the gen ed teacher into making their materials accessible, right? And how do we accommodate our students to be able to access this information that they need to receive because it is in the standards. And as to our people who are supporting adults, it is still just as important, because regardless of their abilities, right, cognitive abilities or anything, physical abilities, they also need to know how to seek help or how to understand the topics we're going to become covering. So essentially, we need to teach it because it is part of our lives. In the case of our students or adults or clients, what we need to really focus is that most of them will have multiple impairments that predisposes them to certain illnesses or infections or any kind of health-related issues that they need to learn how to control. Because again, what we're looking for when we're working with students who are teachers of visual, all of our students, clients, that they could be having an independent life, as independent as possible, and that includes understanding how to care for our health. Oops. All right, so I would like to start with a quote from Bill Gates from 2005. So this was 16 years ago, and this is what he said. "We can't predict when, but given the continual emergence of new pathogens, the increased risk of a bioterror attack, and the ever-increasing connectedness of our world, there is a significant probability that a large and lethal modern-day pandemic will occur in our lifetime," quote closed. Now, to further drive, oops, not that one, not that button. To further drive home this idea, I found a quote from Dr. Jacqueline Miller from the National Science Foundation, who wrote an article that's titled "Becoming a Critical Thinker in the Time of Epidemics and Pandemics." The quote goes like this: "Every 12 to 18 months, a new epidemic of infectious disease erupts somewhere in the world. Most of these epidemics remain contained within a small area where they originated, but the ubiquity of air travel has increased the movement of people and therefore infectious diseases considerably. Accompanying this movement has been the ongoing concern that localized epidemics could become a threat to nations far from the epicenter of an infectious disease. Viruses causing disease such as HIV, SARS, MERS, or influenza have sickened and killed millions around the world. But except the great influenza pandemic of 1918, which killed as many as 100 million people, no infectious disease has spread so rapidly and disrupted everyday life as COVID-19. As of today, COVID-19 had about 242 million cases, killed roughly 5 million people. And of course, we have to focus on those who have also recovered, which is nearly a little over 2 million people. It's in our lifetime. It's here. We need to talk about it, right? Because if we don't talk about it, we don't have that education, then the results can be devastating. So why should we talk about communicable diseases? Again, recapping. Why? Because they're here to stay. They're part of life. They are also called often infections or contagious diseases, which I don't know which word is easier to say, communicable or contagious. Both are kind of funky. And I don't know how our SLP in the audience would be teaching that. But what we need to remember is that contagious diseases can spread from person to person or animal to person. And they are generally caused by bacteria or viruses. That is an amazing lesson to teach our students. What are the differences and what kind of tactile materials can we use to teach that concept? There are major causes of illness. These are, bacteria and viruses are the major cause of illness and disability and death in the US. And this is a perfect time to talk about it. We're living it, right? And I don't know if you realized it, but October would be flu season, but we kind of like got overshadowed with COVID-19. So we should be talking about it because it's a lot more serious at the moment. So you know this, we all know this. It's been touted for the last nearly 2 years. Hand washing is essential. Personal hygiene, general hygiene, and hand washing are essential. Frequent and thorough hand washing is the #1 way to prevent the spread of communicable diseases. But I have a question to you. Have you ever had a student who does not know how to blow their nose? Put it in the chat for me, just so I don't feel alone that has happened to you. Because I had a 17-year-old typical blind student, completely blind student, no light perception. Yes, thank you. Who didn't know how to blow his nose at age 17. I was graduating him out of high school. The only thing he knew is to wipe. So one of the things that we need to tell our students or teach our students is that they need to know how to blow it. Because if they don't know, who's going to teach them? How are they going to learn it, right? And we also need to teach it that once they blew their nose, even if there was a tissue involved and it's not some weird way of, I don't know, using your hands or, I don't know. Let's not go there. That can be gross. So even if they use a tissue, they need to wash their hands, right? They need to know that if they blew their nose or wiped their nose and they go make a sandwich, they should wash their hands before and after making the sandwich, right? But we don't really talk about it. We also don't really talk about the fact that when they go to gym class, and often our students are put on a treadmill, as well as using free weights, for example, that those things are not getting cleaned. So we need to teach them that they need to wash hands and how to wash their hands. And thank you so much for saying, Lord, yes. Yes, it happens all the time. Thank you, Carson, in the chat. I appreciate that. So we need to teach it. Those students of ours who use guide dogs because they are mature enough at 16, some schools already allow guide dogs in class for a client. They need to know that they need to wash hands after handling the puppy before they go eat or they go into a communal lunchroom, right? They also need to wash hands after clean up their dog. Oftentimes it doesn't happen because, they are walking the dog and then they try to pick up the poop and then discard it and then they move on and then they forget. And that's how contagious diseases can spread. ILS, we know it, but we often assume that this is not our job, but it is. So let's talk about another wonky word, respiratory. And many of you potentially have heard me before. I'm a foreigner, so these words sometimes trip me up. But the first group is respiratory, and we start with COVID-19. Why we start with COVID-19? Because it's our living experience. Roseanne Hoffman wrote a blog for APH on COVID-19 prevention and how to teach it. And one of my lovely people will pop it in the chat for you, but it is also on our handout, so you can review it later. But when it comes to today, the CDC recommends is what we are going to go with. We don't want to cause controversy, so we're just going to go with what the CDC says as of today, and that is mask wearing, hand washing, and using sanitizing when water and soap are not available. So those are the things that we need to concentrate on when we're talking to our kiddos. So before COVID, we had our garden variety of common flu and common cold and influenza, right? It is influenza shot season. If you haven't had yours, once you work in education, it is suggested that you get them because every year it's something different. Thank you, Amy, for the link in the chat for the blog. So flu has a vaccine schedule at age 6 months. Anybody older than age 6 months should get a flu vaccine. Why? Because we had the flu epidemic or pandemic in 1918 that killed 100 million people. So even though that a lot of people think that, it's not perfect, no, because it keeps evolving. Just like COVID went from garden variety of COVID to now COVID and Delta variation, right? And then there is like 2 extras already coming because they want to survive. And so they constantly evolve. And then there is the lovely measles that is extremely contagious and very dangerous for our adult people with disabilities, right? It is not a fun thing to do. However, children get vaccinated against measles, it's part of the MMR sequence starting at age 12 months, and then again a booster shot at between 4 and 6. Even though that it has been eradicated in the US in 2000, so only 20 years ago, and not to date myself, but I'm nearly 50, and I was like, this vaccine's been around for a while, okay? So it only in 2000, it was eradicated in the US. And one of the reasons we need to talk about it is because it can cause conjunctivitis or pink eye, as well as blindness, because the inflammation caused by measles can attack the retina, okay? So that is something we need to understand, or we need to tell our peoples, right? That the ones that we're educating. And the book, this amazing book that we're highlighting today, has a very great activity to use with your kiddos, how to teach it. And that is, get a spray bottle, get either a glass, it depends on what their needs are, right? Can they see at all? Is it all tactile? Are they completely blind? But get a spray bottle and get a tissue paper, and then spray at the tissue paper at a certain distance, and then see how far you need to go before the respiratory droplets do not make it to the tissue paper. So the transference is clearly can be demonstrated. And this can be a science lesson, this can be an ILS lesson, and this can be a health lesson. Okay, so it can vary. And the book has many more of these fantastic ideas. All right. The next section of our diseases is those that are transferred through contact. Right? We have our rubella or German measles, which is part of the MMR vaccine series. The reason we need to understand this, especially for those young students that we have, or the adults, the female adults, that if they get pregnant, they should avoid getting measles. Why? They should avoid measles because it can cause congenital rubella syndrome, which causes blindness. And that blindness can be due to corneal clouding or opacification, congenital glaucoma, iris hypoplasia, and what else am I forgetting? Pigmentary retinopathy. It can also cause microphthalmia, just because somebody contracted measles when they were pregnant. And I hope that we all assume that our young girls and ladies that we teach, that they will have a healthy life, and they potentially will have children in the future. So they need to know. Hepatitis A is one of those that can be contacted through stool and blood. And why are we talking about it? Because one of the problems that we see in our students is lack of appropriate hand washing. And they go to the bathroom. We all do. It's normal. So do we teach them how to use a brush for your nails? Do we teach how to wipe appropriately? Do we teach them that there's such a glorious thing that wet wipes that actually gets things clean? Yeah, we need to talk about it. Hepatitis A is one of those that it's around the world. It is not something that has been done away with. All right, and there is a vaccine series for those of us who work with adults and children in K through 12 since 1996. There's a series of shots that help to give it just a tad bit more support other than personal hygiene. We will address the human papillomavirus and the human immunodeficiency virus, HPV and HIV, in December, so come back if you would like to know. Carson says, you really don't want either. Yellow is not a good skin color. Yes, jaundice is not something that's fun at all. Yes, can you imagine adding an extra, but although it's Halloween almost. All right, so the next one, it would be bodily fluids. And I already mentioned this kind of goes along with the respiratory because of the droplets that we, constantly spew, even when we don't want to. But the first one would be tuberculosis. And it transfers the same exact way as COVID-19 or the flu. However, just like COVID-19, TB affects the lungs. And when the lungs are affected, it can actually transfer over to major organs, such as the kidney, spine, and the brain. And then once a virus or bacteria is in the brain, it can cause inflammation. And that's when we talk about meningitis and all that good stuff that can literally change personalities and lives, okay? So when should we be careful about it? Well, we always should be careful about it, but we really have to be mindful if we are in early intervention or we're working with adults who have underlying conditions, such as diabetes, kidney disease, or with babies who have low birth weight, even adults who have low birth weight, organ transplants, and then people who have rheumatoid arthritis or Crohn's disease, because those are autoimmune diseases that if they get TB, it can get much, much worse. And just a personal connection, since I am from Eastern Europe, I was actually vaccinated against TB. So I will never have a negative TB test. I always have to get an X-ray to prove that I don't have TB because I was vaccinated against it. All right, mumps. Mucus or saliva is what is going to transfer them over. And this goes along with that nose wiping and sneezing into a tissue or the elbow crook, right? Not in the hands, because when I sneeze into my hands and I hold the door, open the door, then the person behind me is going to be getting all my boogies, right? So one of the, as I was reading through the book, one of the things that surprised me is that mumps actually can take anywhere between 16 to 25 days to figure out that you were infected. That's an insanely long incubation time. And so in the meantime, our kiddos or adults don't have symptoms, so they don't know they are ill, but they're spreading it. So I think that goes along with today's climate. We don't know what we have, and so we're inadvertently spreading it. Why it's important? It is important because it can actually, due to the inflammation of the brain, which is the encephalitis, or inflammation of the tissue around the brain, and I throw out another big word because I'm brave, is meningitis, that they can cause deafness. And so if we already have somebody with a sensory impairment, we don't really want them to get another one on top of it, right? So that is also something that we need to pay attention to. It may just simply result in visual acuity reduction or color perception reduction, but it can actually cause severe visual field defects as well. So HAP BNC goes along with the ABCs of HAP. The difference is that when it comes to BNC, they spread through blood, semen, and even during birth. So again, I'm going back to our young ladies who we are teaching, who potentially will want to have children later. They need to know that this is something that can be transferred from them to the baby, the child. They're all liver diseases, but they are caused by 3 different viruses. Yes, they are. And then the CDC says so, that there are 257 million people who are living with Hep B worldwide. So that is something to, if you will have a person who wants to travel, they need to know, right? Very good. All right, let's go to the next one. Before I jump into the non-communicable diseases, I would like to engage you in the chat and tell me, do you teach communicable disease prevention or hygiene, or run them in the chat? Let me just take 1 minute here. It's not such an exciting question like, do you know if your kiddo can blow their nose? That was a hot question. But do you ever consider teaching? It is okay if you say no, because as we know, the majority of the people on this call were not available. They didn't know about the book. Thank you, Leanne. Yeah, or assist when it is a topic in the classroom. Making accommodations. Thank you, So Young. I hope I didn't butcher your name too badly. I think one of the things that we need to remember, and I'm not trying to put anyone on the spot here, I promise, especially since we have people who work with adults, okay, in the audience, is that we often assume that they either don't know how to do it or we're too late to teach it. I have worked with adults for nearly, well, kind of sort of adults, young adults, right? And I also worked with elderly people who had dementia and Alzheimer's. They don't wash their hands anymore because it's just not something that's on their, it's on their mind. Leanne says, it is a hard topic to think about. We might not have even thought about this topic before. That's right. We would teach and talk about hygiene with our Braille readers. Yes, Braille. If you have sneezed all over your Perkins Brailler, how are you going to clean it? That's an AT lesson. That's a hygiene lesson. Supplemental instructions. Yes, that is our job, right? It fits within the ECC curriculum, and we're going to keep thinking, okay? Because we are going to be engaging you soon in an activity. Thank you for that. Cooking lessons. Yes, that is the general area when we are talking about. Taylor is saying that talk about it during teaching, and we are going to address that just in a little bit. All right, so let's go to our non-communicable diseases. The question is, does your student know if they have some sort of a syndrome that is genetic? Do they know the name? Do they know how they affect them? And do they know the whys? How did it happen, right? Can they comprehend it? If they cannot, can we teach them symptom control or how to seek help, right? So genetic factors play into the role of many kind of eye diseases, and more than 60% of cases of blindness among infants are caused by inherited eye diseases such as congenital cataracts, glaucoma, retinal degeneration, optic atrophy, or a variety of eye malformations. Those are genetic. But do we teach it? Do we even think about teaching it? And up to 40% of people with VI who have some type of ocular misalignments or strabismus are also have family history. So it is worth thinking about this stuff and potentially putting it out there for our students. Furthermore, and I just lost the thing on my throat. Okay, I don't remember what I was about to say. That's okay. Another area that we need to mention is that often behavioral factors can also affect and cause diseases. And we know that there is an epidemic of obesity, so it is something we need to talk about. And that is really, behavioral factors are when it's a prolonged time, for a long period of time, making unhealthy decisions. And that is something we also need to talk to our students about. So the first area we will tackle is the cardiovascular disease. And I am not going to give you a biology lesson on it, but just a few things to think about is that is essentially what it will result in is inefficient blood flow. And when the heart doesn't pump enough blood, that means there's not enough oxygen that's getting to the organs, and the eye is an organ. So if the oxygen is not getting there, the eye will not function correctly. And that can lead to a bunch of different signs and symptoms. And there are nearly 600,000 deaths due to cardiovascular disease a year. And some of the dispositions are genetic, because there's a genetic heart defect or some sort of a syndrome that caused the heart defect. And of course, high blood pressure. High blood pressure does not necessarily mean that there was somebody doing something wrong with behaviorals. You know, they were eating hamburgers every single day. It could be genetic. They can be completely healthy and skinny and exercising and still have high blood pressure. However, high blood pressure can result in a stroke, which is a traumatic brain injury. And so I had a 15-year-old who had a stroke. And you know that because you probably have seen children who have had strokes. Children can have strokes in utero, right? That's not because they ate too many hamburgers. It's just something that was genetically predisposed for them. When it comes to the eyes and cardiovascular disease, what we need to remember is that when there is a deficiency in blood flow, the vision can fluctuate, and the vision loss can be transient. So it's just periodic. However, if there is a real developed cardiovascular disease, then it can result in blockage, right? And that can actually happen in the retina as well. Things that we often see is the retinopathy, diabetic retinopathy, just retinopathy in general. And of course, cataracts. And in our older population, in our older clients who are ONMs or other people in the audience, is the age-related macular degeneration, the AMD. It also results in the fact that we need to teach how we measure, how we handle high blood pressure, right? What kind of medications are we taking, and how are we going to teach self-care when it comes to that? The next area we will cover just very quickly is cancer. It essentially means that it's a disease that abnormal cells divide uncontrollably and destroy the healthy body tissue. And this can also be due to defective DNA or because of environmental exposures, or the genetics, so it's inherited from the parents. There are over 100 types of cancers, which is why I'm not qualified to talk about them, but it's just worth noting, mostly because of the genetic factor of it. Meaning that if the parents have it, then we need to make sure that the children are aware that it can potentially be something that they will have to be exposed to, especially for both males and females, the breast cancer, then prostate, lung, and colon cancers. So those of our students who have some sort of a syndrome that is digestive, and that affects digestive system, we have to make sure that they know what to do. And of course, the healthy behaviors, avoiding tobacco, healthy diets, exercise, and weight management are essential for the reduction in the risk of getting or making it worse than what it should be or can be or would be. When it comes to the eyes, we are most likely, if we are vision professionals, will know of retinoblastoma. That is something something we see at least once in our career, the ocular cancers. But we also have to be aware of the brain tumors, especially those of you who are working with adults, adult clients. Brain tumors can cause vision loss. And for ONMs, brain tumors can cause crazy vestibular or proprioceptive issues that we need to be aware of. Even if they are not cancer but benign, they can be very destructive. Some of the conditions or cancers may or may not directly affect the eye, but one of the side effects can be chronic dry eye. So if we have a child in our classroom who had childhood cancer, please not, but it happens. If they get chronic dry eye and they are low vision and they are using their vision for access for school, for classroom materials, and they have this chronic eye, that causes pain. And so how do we teach them to mitigate the effects? And diabetes. We talk a lot about diabetes in general. APH has a really good webinar, and my peeps in the background will put that link into the chat for you, and we also have it on our handout. But things that we need to remember is it's a long-term condition. It can be type 1 or type 2. Type 1 is generally diagnosed in children under the age of 20, and type 2 is mostly in adults. However, there is a rise in type 2 diabetes in children due to the obesity epidemic that we're living in. And the most common one is diabetes mellitus. It's essentially a disease that has functional issues with the insulin. Again, I teach this for a whole class, 75 minutes in at FSU for my TVI2B. We don't have time to go in it, but go to that book. The Health Education book has a good enough section on it that gives you the basics to understand it. But what are your roles as an educator when it comes to diabetes? We need to understand the condition and the limitations that diabetes will have on our students. You will never make a child who has severe neuropathy a Braille reader, even though they are blind completely. It's not going to happen. We need to encourage our students to develop self-sufficiency and autonomy. We need to maintain adequate and good communication with the family. And of course, we need to encourage our parents alongside us to be very involved team members when we're talking about children with diabetes. Well, with all our children, but especially here. So what can diabetes, how can diabetes affect our students, right? As educators, what we need to know is that, one, we need to recognize if a child is having a hypo or hypoglycemic incident, right? We need to be able to assist our children to make decisions about diet and exercise. And that's what we're talking about today, nutrition and disease prevention. Our students need to understand when they are ill. Can they recognize that they are not feeling good today and why that might be? It's called problem solving, right? Within self-determination. Do they have self-advocacy to speak up that they are not feeling well that day? They need to know, and we need to know, when to seek additional help. If the child is having an emergency while we're instructing, or the adult, the client, is having an emergency, do we know how to handle that emergency? And one of the mantras in the island is we need to be protective, but not overprotective, and we should avoid being reactive. There's a lot of activism in there. It's not pro, it has to be pro, it's not reactive, okay? All right, so one of the things that I, as an O&M, was taught, because I had an amazing teacher, is that I always have to carry glucose tablets or some form of food with me when I go out on lessons if my student has diabetes. Glucose tablets are small packets. You can buy it in any pharmacy. It does not require a prescription. There is also something called glucose paste that is very good to have on you if you have students who have diabetes. We also have to be aware of that they might need to go to the bathroom a lot more often than our other students. So we need to build in break times. And we also need to be aware of it that diabetes can cause eye aches and pains as well as headaches. Everything that's involved in the head, blurry vision, watery eyes, halos, temporary vision loss, all kinds of fun stuff just because of insulin, either too much or too little insulin in the body. Hang in there for one more slide and we're gonna do an activity right after. So vaccinations. The authors of, and I will quote the authors of the Health Education book here. Just as medication help to treat and prevent various diseases and conditions, vaccinations are another type of disease prevention. In popular media, there is a lot of controversies around this. But overall, if we look at science and what has been going on for decades, there are vaccination schedules for newborns and small children, as well as those who work in certain industries that predispose them to microorganisms beyond what we all do, get in contact with. So we recently completed a webinar series on career education, and there are two options for a student. They either go into industry because they're gonna seek a job and hopefully get one, or they go into higher education. Well, most higher education institutions will require proof of vaccinations. Maybe not COVID yet, but just the general stuff, the MMRs and the TB test. Do your students know there is such a thing as a proof of vaccinations? Does your student or adult know where to get such a proof? Maybe, maybe not, right? We don't really talk about it. And they also need to know that many careers will require vaccinations. They need to know. For example, in a couple of weeks, I'm going to a conference in Texas. It's by the Council for Exceptional Children. And every single CEC conference, the next 3 that I have registered for, because I'm presenting, require proof of vaccination because we are trying to return to some sort of normalcy. We'll see how it goes. Tetanus is one of those that also children get, but then they need boosters. And why am I bringing up tetanus? I think it's probably because most people know tetanus shot exists, and some of us maybe had it as adults. But if your student likes to garden or travel, it is something that they potentially need a booster of. Okay, it's called the what is it, DTaP and TTaP vaccination on the vaccine list. Because tetanus is something that can be caused by microorganisms that collect, let's say, on a rusty nail in the garden that you accidentally touched and got hurt on. And sometimes if we cannot clean that out properly, again, another lesson for, independent lesson on how to care for wounds, first aid. But if it's not clear, it can cause tetanus infection. So if our kiddo likes to be outside and likes to, or let's say we're teaching in a rural area where farming is big, okay, or animal care is big, your students need to know tetanus, okay? And of course, rec and leisure. My partner and I went to Asia for a trip, and we couldn't get on the plane until we had 2 more shots because we were going to Thailand and Cambodia. And so we needed extra vaccinations to be able to travel. And that was pre-COVID, okay? All right. So I would like to invite you to take a deep breath with me, take a stretch, and go to our Jamboards. So I am going to ask our lovely people, and I'm going to figure out how to share. I probably will stop sharing for a second. We have 2 Jamboards. If your birthday is January through June, there is a link for you. That's the first link. If your birthday is July through December, then please click on a second link. So the first one is January through June. The next one is July through December. And when you go to this Jamboard, we would like you to engage with your typing skills and give us some Post-it notes on how did you ever teach this, or based on the information that we have shared so far, how would you now go back and teach these topics to your students or clients? And I will attempt to share my screen. Oh, and if you want to get those of you who are using assistive technology, Control plus Shift P is what's going to get you to a quick sticky. And Manda, while I try to share with you, please monitor the Jamboards for me.
So perhaps you could just remind us one more time, what are things that we're thinking about in order to reflect on our Jamboard?
How would you, based on the information we shared so far, beyond the nose blowing, is how would you, and I'm not sure what's going on with my sharing here, so I'm going to stop sharing for a second. How would you approach teaching these topics that we have shared about so far, or how have you potentially have taught these topics before? And I will get there. I don't know why. There we go. So the two links to the two Jamboards, if your birthday is January through June, is the first link. And if your birthday is July through December, it is the second link. The reason we have two links is because Jamboards tend to jam, not to, you know, no pun intended, but it does. And love to see your thinking. What do you have in mind? All right, I see some stickies coming in, and I will move things around so I can share. All right, so the July through December people, sometimes stickies get stuck on each other in the left upper hand corner. So that might be something that happens. So just feel free to, sometimes they stack. So the July through December people are sharing that talk with the school nurse to give proper orientation and demonstration. Yes, we are definitely not people who are qualified really to be talking about how to do diabetes stuff, right? But yes, enlisting the school nurse is an amazing opportunity. And speaking to that nurse on how to make things accessible for everyone in the classroom. Very nice. Okay, and then I am going to look at oh, look at that. January to June is busy. I am so excited. All right. Math lesson story problems on figuring dosage. Brilliant. Talk with the general educator to find out what's being taught in the classroom. Yes, we should be, right? Because that's how we're providing accommodations. Lessons in history on disease and vaccine development. Oh, I would love to be sitting in on that one. Oh, somebody found a pen. Don't panic. You can also write hand. If you can manage that mouse, you can write with that pen as well. Yes, the hand washing song. I think the hand washing song probably makes our ears bleed at this point if we're teaching that because of COVID. With adults, it would be a refresh. Yes. We don't often think about a person with declining cognitive abilities that they should potentially be retaught how to wash hands properly for disease. Oh, and somebody said, I love the idea of the spray bottle. Yes, it's an amazingly simple idea because you can use the window or you can use tissue paper, so it can be visual. You can also put, and I don't know if this was in the book or if I'm just making this up based on experience, but you could put food coloring in it. So it actually shows a color for those who want to use visual representation. All right. Oh, look at that. I'm so delighted that you guys are able to engage with the Jamboard. Talking with the PE and health teacher. How about teaching our students how to use Clorox wipes on the equipment that we have used in the gym? For example, that goes along with tactile search patterns, that goes along with how are you going to clean up your kitchen counter, how should you wipe your sink, and wipe your weights. Hand sanitizer. Yes. The one thing we need to make sure that we teach our students that hand sanitizing is not a substitute for appropriate hand washing with soap and water. Because one, hand sanitizer takes about 2 seconds, not the 20 that hand washing is required. And also it does not remove dirty stuff and not under the nails. So that is something that we can keep in mind. However, we can also just have them carry hand sanitizer with them, right? That's what we all do. Like we don't even leave the house now without a little tiny hand sanitizer hanging somewhere. All right. And I am turning it over to Manda.
Okay. Yes, perfect. I am unmuted. So we learned about different diseases and all of the reasons like why we want to teach hand washing and keeping things clean. Another way that we can focus on health is through diet and nutrition. And nutrients are the basic components in food. And in order to understand food groups, students really need to be instructed in what nutrients are. And nutrients can include things like carbohydrates, fats, proteins, vitamins, minerals, and all of these things come together and are incredibly important for health. So in addition to knowing what a nutrient is and how it supports the body, students need to be aware of the different types of foods that supply the nutrient. And there are often healthy choices and unhealthy choices. Carbohydrates are a great example of things that can be broken down into simple carbohydrates and complex carbohydrates. Simple carbohydrates are sugar-based, and digestion is not required in order to access that sugar in the bloodstream. And so this can be used immediately, like what Erika was talking about with the glucose tablets for students who are diabetic. Or there are more complex carbohydrates that require digestion in order to be broken down into energy that the body can use. And the health book that we're talking about provides a beautiful and relatively easy way to communicate this with our students through an experiment. So there's an interactive activity about complex carbohydrates that requires mechanical or chemical digestion to break down. So if you check in and know what your students, if there are any allergies or we really want to be aware of that, you can provide a piece of white bread with the crust removed, have them put the bread on their tongue until the saliva begins to break the bread down. And what's going to be left there is a sense of sweet, like a sweet taste, because the starch in the bread breaks down into sugar. So this is a way to have our students experience it firsthand. And it's also a beautiful opportunity to pre-teach the concept that digestion begins in the mouth with saliva. Similar activities can be designed to discuss other forms of nutrients. So that way the student has a foundational understanding before moving into food groups. And this can be done through things like nutrient sorts, creating card games similar to Go Fish with each nutrient category. So you can have, be like, okay, what you're asking for is a type of fruit, and then your student would I'm sorry, not a type of fruit, a type of carbohydrate, and then your student would pull from the card, similar to Go Fish. I tend to rely on card games a lot to teach concepts. And both of these things can be tied to the expanded core curriculum through sensory efficiency as well as social skills. So once the students have an understanding of nutrients and what nutrients are, instruction can move on to food choice based on food groups. And the United States Department of Agriculture has provided the official guide for nutrition called My Plate. And with My Plate, each food group is represented: fruits, grains, proteins, dairy, and vegetables. And there's an image on this slide of a My Plate that was created using WikiSticks to provide a tactile breakup of what the plate looks like. And then this is something that can be replicated like with your student. Have them create this My Plate using tactile graphics or whatever means necessary. You can use large print or braille labels, and then students can recreate their personal plates. You can also incorporate access technology when it comes to My Plate, and access technology just into health lessons in general. Screen readers and screen magnifiers can be used to visit choosemyplate.gov and while the students create their own daily food plans. Technology skills can then further be supported if you have the time and the passion, or find other resources through like the creation of like web quests, or almost like web-based scavenger hunts. Moving on to food labels. Exploring food labels is also a place where we can provide instruction in technology and daily living skills. Students learn how to use different devices and apps to read nutritional information from the food label on products. So an idea for teaching this is through a food label scavenger hunt, where a variety of foods with packages on can be placed on a table, and the student has to locate the items like with the specific criteria, like find the item that has a serving size of half a cup or something. So they would use their technology device, maybe it's a scanner or a phone or anything, and they can find the label that matches whatever the qualification is. So calorie content, and this is really important for personal implications, because they would be able to learn how to identify whether or not the food that they're eating has a common allergy, such as egg or milk or soy or nuts or anything that they are intolerant to. Food labels also provide ideas when it comes to portion sizes. So again, these lessons and activities just keep building on one another. We discussed the nutrients, we discussed food groups, we introduced the concept of portion size. So now we're really going to understand and develop how to portion out portion sizes. So yeah, it's great to eat balanced, but we also need to make sure our students know that the amount that they eat is just as important as what they are eating. So how do we teach portion sizes? Concepts of portion sizes lend itself beautifully to independent or daily living skills. And as teachers with students with visual impairments, we also want to teach multiple means of access. I like to have a high-tech, a low-tech, and a no-tech form of instruction for my students. So a high-tech method of measuring portion sizes can be taught through a talking scale. A low-tech method can be through large print, braille, or tactile measuring cups or measuring spoons. But my favorite thing is to teach my students how to do anything with something that they will always have with them. And one way to do this is to teach measuring by hand. And this is actually a graphic that is in the Health Education book. And on the slide, it outlines how certain parts of the hand can be used to help measure different serving sizes. So the front of the hand, if you hold your hand up and clench your fist, that front part of the fist is roughly half a cup, which is the recommended serving size for pasta. The palm of the hand, if you open it up, the palm of the hand is approximately the serving suggestion for meat, which is 3 ounces. Clenching your fist again, the whole fist is 1 cup, which is a double serving of ice cream. I guess I eat double servings of ice cream when I do my measuring. The fingertip of your index finger is roughly 1 teaspoon. If you use your thumb from knuckle to tip, that's about 1 tablespoon. And taking into consideration, again, any food allergies or intolerances, teachers or specialists can design experiences where students and clients measure out various portion sizes using their hand as a measuring guide. And it can kind of be fun, and you can like interweave the different modalities or tech parts. So start first with your hand and then put it in a measuring cup and see if you got close, and then weigh it. Like what's the difference there? Experimentation is always fun. So it's also important for students to be able to understand how their actions and choices can influence their health. Like previously mentioned with high blood pressure and diabetes, we need to teach our students how to monitor, or how monitoring their health status is really vital for their well-being. And a lot of these things lend themselves to compensatory access, to math skills, to teaching tactile graphics. We can calculate the height, weight, and waist circumference, which not only allows the students an opportunity to use the tactile large print or talking tools, but the numbers can then be used on an app such as a phone, a computer, or a tablet to calculate the student's BMI or body mass index. When students know their BMI, they are then equipped to make informed decisions regarding their health, because then they have that understanding, of like concepts leading to overweight, underweight, or obese. And learning about weight, height, and waist circumference also provides our students an opportunity to learn the correlations between health and different sizes for clothing. So we're going into the community on orientation and mobility lessons and finding different clothing sizes. Yeah. So teaching students how to use the access technology supports monitoring health and encourages further development in independent living skills. And a bit of creativity can allow the lesson to touch on compensatory access linked with the creation and interpretation of math data tables or math graphs. You could work with a general education teacher, maybe that's a science teacher or a health or physical education teacher, to collaborate on lessons that teaches how the body breaks down food for energy. You could create graphic organizers and data sheets that could be used to track the number of calories consumed during the day, bringing in a pedometer or a fitness device that can be used with access technology, so they can monitor the number of calories burned. On an O&M lesson, you could go out and look at Braille menus and see if they have the caloric content, or you can research the caloric content of, say, a cheeseburger meal. And then as a follow-up activity, you can calculate how many minutes or specific hours of a specific exercise that meal costs. So double cheeseburger meal might be 2 hours of bicycling. I'm not sure. But yeah, really having these frank and open conversations is important. But staying healthy also involves knowing how to protect against foodborne illness. And we talked about hand washing when it came to prevention against disease. It's also here in the kitchen. Hand washing helps protect against any sort of like food poisoning or transferring salmonella from one that can be found in raw meats. So washing your hands protects against foodborne illness. It's also important to maintain a clean and organized workspace. And our students should know that there should be a separate space if you're dealing with raw meat versus like fresh vegetables and produce. If you're handling raw meat, you need to wash your hands before going and working with other products. Organization is also something that's important and can be taught. That includes the labeling of kitchen products to help ensure that what's being used is still fresh and not out of date, or that you know what you're using. In addition to that, we can also teach points involving temperatures, and that can be supported through talking or large display thermometers. Not only can microbes live on surfaces of objects, but they can also reside inside. And the only way to kill those microbes is in the meats is by cooking them to specific temperatures. So again, the primary focus of our instruction, whether it be targeting compensatory skills, access technology, or independent living skills, is to teach our students how to be independent and healthy. We teach about food, nutrition, and the prevention of disease and illness, because it's a part of the student's well-rounded education, which means it should also be part of teachers and providers' well-rounded professional development. Okay.
Thank you, Manda. I'm sorry, I'm hurrying you along because no matter how long our webinars are, we always run out of time. So overall, what we've been talking about is that the expanded core curriculum is our best practices. We have weaved it into every single topic that we talked about today. It is something that we all have to keep in mind, that yes, we collaborate with our people that we work with on our teams, but our job is to give a well-rounded information, well-rounded education. We plug in the holes, fill in the puzzle pieces that our students cannot get through the core academic curriculum. So hopefully, even though that we do not have time to have another brainstorming with you, that we've given you enough information to start thinking about how are you going to use your instruction with your ECC, and including this health education book, which is chock full of information and ideas on how to teach these ideas, that you can start thinking about that. And again, this book is good for everyone, not just children, so all of our older population as well. So just in conclusion, visually impaired students may have even higher rates of obesity compared to other disabilities because of the lack of physical activity, poor food choices, and dietary habits. We must need to keep this in mind as we are concluding our webinar and our instruction at the moment. So here's our references. It's in your handouts, and we appreciate your time that you have spent with us. And here's to Amy to close us out.
It is great to have all of that information, and I will steal from you, Erika, about how you both very naturally applied the areas of the expanded core curriculum into almost everything that you talked about. So again, everything stems of what we're talking about today with our first and the third webinar series to our health education guidebook that's for teachers. And we invite you to come back November the 17th for our second webinar, which will be on the topics of personal health and safety. That will be in November. And then in December, we will have a webinar dedicated to sex education and what we need to know as educators to help our students with visual impairments and gain access to instruction of health instruction in the classroom. Let me pause.